Jeff, Kathleen, everyone, welcome to our weekly conversation here on reopening schools in this very odd circumstance we all find ourselves in. And we are really, as you know, having weekly conversations with folks, been focusing to date over the summer on working with state and local educational leaders to hear, what are you doing in context of planning, and just a real sort of boots on ground perspective. And today we're taking a little bit of a pivot because of the NASEM report, National Academies of Science, Engineering, and Medicine, just came out last week. And you know, we've had the opportunity in relationship with Kathleen Moore and with Jeff Vincent, who were on that committee and have been involved in these conversations for months and are really you know, leaders in this conversation nationally. So ask them to be involved here today and to give us their synopsis and overview as members of this committee on the report itself, and to field your questions and comments directly. So just a brief bio. Hopefully you saw the emails that came out. Hopefully you saw the right email that came out, because we had a bit of a snafu on our end, and Kathleen has been very gracious with our error, sending out the wrong person in the first draft. So many apologies again. And so Kathleen, 30 years of experience in education, working at the California Department of Education, leading their facilities and planning department, and with in doing work in consulting with school districts around the country at this point as well. And Jeff Vincent, professor at UC Berkeley, studying urban city planning, and done a lot of work nationally with the National Council on School Facilities and independently on looking at inequities on our communities, particularly as they focus around schools. So with that extremely cursory and interview that does not do justice, but I really welcome both of you and thank you all for being part of the conversation. And I am going to very gratefully hit mute and get out of the way and let Jeff and Kathleen walk us through this report. And as questions come up, please put them in the chat, and I will field them as we go and moderate them to Jeff and Kathleen. And if I don't explain your question accurately or frame it the way you think, unmute yourself and let me know, and we'll get it right. So Jeff and Kathleen.
Thank you.
Okay, great. Yeah, thanks. It's great to be here. And, you know, I think Kathleen and I both have participated on almost all of these webinars, you know, going back to March or April, whenever they started, you know, working closely with the National Council on School Facilities. So I would just like to say I've learned an enormous amount from these discussions. So I thank everyone for that. And, you know, Kathleen and I were funneling that info into the discussions here at the National Academies of Sciences on this. And so I don't know if you want to say hello, Kathleen, and then I'll jump into it, or.
Yes, Jeff, thank you. And echo your comments on taking this information that we received graciously from all of you into the committee work. It was very helpful, and hopefully there's pieces of this that respond to those questions and issues.
Great. So, you know, Kathleen and I were very fortunate to be invited to be on this committee with the National Academies of Sciences, Engineering, and Medicine. And you can see all of the subcommittees that are involved in that: Standing Committee on Emerging Infectious Diseases, Board on Children, Youth, and Families. So it was a very interdisciplinary group of folks, which is always a treat, of course. Why don't you go to the next slide, David? And, you know, just to recap, I mean, they were, yeah, go, well, here, okay. So here you can see who was on kind of the main committee. And as you may be aware, you know, these are consensus committees, and this is what the National Academies is known for. This is what they do. And so, you know, they really arrive at a consensus around a question plaguing, that policy folks or researchers have around, what's the state of affairs on X, Y, and Z. And so that's really what we tried to do, is review, or that's what we did, was review all the evidence what we know on COVID, which, as you all know, is rapidly evolving, by the minute and the hour. And so it was an enormous, I described it always as like a fire hose in my face at all times, but what a fun fire hose, I guess. In these times, trying to find light, where you can find it. But you can see we had, folks from Johns Hopkins and other medical professionals, as well as folks in school districts, folks doing education and education equity work, Kathleen and myself, who come from a little bit more of a school operations and school and facilities background, and a few researchers. And this was all supported by the National Academies staff, who really did a lot of the writing and the legwork between meetings. Collectively, it was dozens and dozens of hours of presentations from outside experts on various issues related to viruses, related to education equity, related to the role of schools and communities in providing supports to families, et cetera. So why don't you go back to the previous slide? And so the overview, or the charge, really was to draw on evidence from epidemiology, public health, education, and social and behavioral sciences about when and how to reopen. As you all know intimately, you cannot overstate the complexity of physically reopening schools for site-based instruction, period. And it has to be said, in part because of just the headlines about just reopen, how hard is it? That you're seeing from some individuals here and there. And so, our review is obviously happening in the midst of that. But what we attempted to do is try to articulate a clear understanding of what's known, what's not known, in terms of answering the question on the ground of when and how to reopen. And so, I think that the report certainly is a great timestamp of what's known about those questions at the day it was released. It's 2 weeks old now. So why don't you go ahead to 2 slides. And this might be a fancy slide. You could just keep clicking so it actually populates. I think, a few big concerns that committee members had and that are really reflected in the report. One is issues of equity. Obviously, public education is fraught with concerns about inequities. We're all very familiar with those in our various states, but also the conflict, the intersection of that with the health disparities that we're seeing. And these are being magnified with the spread of COVID, as we well know. But, in terms of the big concerns that the committee was grappling with, was there's an enormous amount of responsibility falling on local districts to make very, very, very complicated risk decisions. And that weighed heavily on us. And also that many districts may not have the financial resources to implement all of the implementation measures that are being recommended from a variety of sources. So us trying to wrap our heads around problems of inequity, problems of where responsibility lies, and then how you have the resources to implement these mitigations were front and center. And if you do spend some time in the report, you'll see that those are overarching themes. And we're learning more about these things every day here, these bullets here, but we're learning much more about the disparate conditions that more marginalized communities are experiencing in terms of COVID outbreaks, and that partly has to do with health quality access, but also to the prevalence of essential workers in different types of communities. And so the issue of being very cognizant of not wanting to exacerbate either health inequities or existing education inequities was a big lens with which the committee looked at this issue. So when you go to the next slide. And click clear here. So, you know, without going into all the details that the report outlines on these things, I mean, what the report does is the first couple of chapters really try to outline what is known and not known about both transmission and symptoms and mitigation strategies out there, because, you know, there are a whole suite of those things. And obviously the knowledge of all this stuff is evolving day by day. But what we do know is that, you know, children, based on the evidence to date, children are less likely to experience severe symptoms. You know, scientists believe they're not strong transmitters, although clearly that is evolving. But of course, children aren't the only one inside schools. There's quite a lot of adults there too. And so, you know, older children who have lungs and other, you know, physical, you know, body parts more like adults are much more susceptible to both transmission and symptoms is what we're finding. But that the adults in schools, that's where, you know, it appears that there's, you know, an enormous risk, health risk to them in terms of transmission. And so we outline the science in those things related to children and adults, and then outline the science or what's known about the various mitigation strategies. And I think, you know, as a committee member, I mean, you know, personally, one of my concerns was that, you know, there's really limited evidence on the various effectiveness of, you know, the various mitigation strategies. And we try to dissect that and go through it. And I'll come back to that a little bit later. And then chapter 3 really talks about the role of schools in child development, the role of schools in children, and tries to understand the sort of risks or the costs of having schools throughout our communities physically closed, right? You know, which is kind of the flip side of, you know, mitigating the risk of virus exposure through being completely closed, but trying to understand that what are all the things that schools serve in our communities through providing lunches, through providing you know, supports to students who have special needs, et cetera. And, you know, one of the things that I thought Kathleen and I in particular added to the report, and as our colleague Mary Filardo as well, who provided some advice to this committee, was really to articulate the role that the physical conditions of school facilities play in implementing mitigation measures. And you know, I was very pleased that we were able to effectively make that case, and also to have the report state that physically reopening in poor condition school facilities will be riskier. It will be both harder and it will be riskier from a virus mitigation perspective. And I think that's a pretty bold statement, a true statement for the report to make, but also I think one that, you know, a topic that is too often overlooked. And I'm glad certainly to see the issue of school facilities, whether it's HVAC, whether it's drinking water, whether it's cleaning, you know, getting more and more attention in the media and in policy recommendations. But I thought it was a good thing for this report to sort of put a stake in the ground on, and I think it does a good job of doing that. And so in part, I thank, you know, some of the folks here on this call for helping us think about that, helping us make that case in there. So next slide, David. Okay, populate this one for me. Okay, so what the report focuses on is laying out a framework for making local decisions around reopening. I think that, you know, the committee felt that it was important that locals were the ones driving the decision making, but that, you know, the hyper-local reality of every single school district trying to make that decision was going to be problematic. And so, you know, what we really do is lay out a framework for looking at collective decision-making that involves public health officials, but who are monitoring real-time community-level data on virus spread. And we're going to talk more about that, and we point to examples in both Texas and Oregon, and more are coming online, over time, but frameworks for developing thresholds for the community or county-wide, whatever the geographic area is, indicators of virus spread in a community, and relating that to what the risk is in terms of reopening. And then chapter 5 talks about, really dissects all of the various mitigation strategies that are out there. In particular, we're looking at the CDC. We didn't spend a lot of time looking at, the differences in state level guidance, but a lot of those obviously draw on the CDC. And I think this is an important chapter in the sense that it makes it clear that, okay, there's a whole suite of mitigation strategies, and all of you have been freaking out about how do we make these work on the ground, right? And coming up with good ideas to do so, but obviously, it's enormously challenging. But that there's not a lot of good evidence, research, scientific evidence, and knowledge to guide the relative effectiveness of different mitigation strategies. So, should you be implementing everything and everything all the time in every square inch with every person every day all the time? Ideally, perhaps yes, but the reality of the feasibility of doing that may be challenging from school to school. And so we try to grapple with that. And in part, that's one of the big recommendations at the end, is that we need to understand these things. The second bullet there on the bottom, the cost of mitigation. So one of the other big messages or themes in the report is that you can't just open, right? There's a lot of risk involved, obviously, but that there are costs that must be, there are costs associated with implementing recommendations, whether it's, having smaller class sizes, whether it's improving air filtration and ventilation, whether it is, doing more cleaning and disinfecting, et cetera, right? As you all know, and we've talked about on the webinars here, there are costs associated with that. And Mary Filardo and others had done a lot of good work on, okay, what are the costs? Let's enumerate them, right? Let's try to model out if a school or district was to implement these mitigation measures at a certain level, what's our assumed cost around those? And I think being able to put some estimated numbers on that is really important, particularly as we're looking at, getting back to local responsibility, the responsibility that's falling on school districts. Part of what we point to in the conclusion and then the recommendations is the important role of the states and the federal governments to step up to provide resources that enable school districts to reopen safely. And then we also talk about this last bullet here, creating a culture for maintaining health, sort of what I call kind of a local culture of compliance. That is a partnership between schools, school employees, children, their parents, perhaps even their extended family, about we're all in this together. There has to be a culture of compliance in terms of whether it's mask wearing, whether it's hand washing, whether it's, being honest about reporting if someone in their family is experiencing symptoms, right? All of these things are critical to minimizing risk. And so that responsibility falls on all of us. And, actually there was a good piece, to mention Mary again, that Mary Filardo had in the Washington Post this week about, the role of kind of the parents as partners with schools in reopening. And she does a nice job of outlining some of these responsibilities about what parents can do as well to minimize risk. So why don't you go to the next slide? And so I think at this point, I'd like to ask Kathleen to step in. But the last thing I think I would say is that, I think that kind of the big takeaway from the report is that the committee felt that school districts should prioritize physically reopening, particularly for younger children, but only if kind of two big conditions are met, right? They have a lot of detail within them. But one, if community virus indicators are low, and you have to set those thresholds, right? And two, that there are ample resources available to implement the mitigation measures. And the report really spends a lot of time talking about what those things mean. But I'll ask Kathleen to kind of jump into the recommendations, and we're not going to run through every single detail on all of them, but kind of give you guys a high level of where they are. You know, and the first one being kind of about the decision to reopen. So Kathleen.
Thank you, Jeff, and good afternoon to everyone, and especially I see some of my former colleagues at the Department of Education. I'm glad to see you all here. I'd also like to put a little frame on what the report, you know, the 11-minute elevator discussion about what our report is. And it really focuses on providing guidance to districts on whether and how to reopen. And actually, I would include in that component of when you may need to close again. And our committee really agreed that this decision is made at the local level, but it cannot be made without the partnership of health, county health, state health entities, as well as a myriad of stakeholders providing that information and feedback to school districts. Mm-hmm. And really what this recommendation number 1 is saying for districts to weigh the relative risks of reopening against the educational risk of not providing in-person instruction in 2000, and give a priority to in-person instruction for grades K-5 and students with special needs. It does not say to open or not open. It really provides this framework for decision-making that Jeff provided a lot of the detail concerning. And I think too, I saw some of the questions or some of the questions come up in the chat box, and I'll just answer a couple of that, David, with your permission. That
please, I was going to interject on those, but please go ahead.
And it's around risk to students, and you know, as Jeff said, the research and the knowledge is ever evolving. So every day we're all consuming different reports that come out. And at the time of our report, I mean, what we indicated in it was we know children are at a lower risk. And however, I think the real piece and partially eye-opening for me was that we really don't know how easily they contract it, nor how they are as transmitters. There's just insufficient research. And I think given that fact, and together with schools as workplaces for many adults, this was a particular concern, and as the committee deliberated their work. So why don't we go ahead to the next slide?
Yeah, and Kathleen, if I may, you know, looking at those questions as you're going through sort of the recommendations here, you know, I think the conversation is when does a child who we think is less risky to transmit at this point, and we think is gets less adverse reactions than adults, when do they become more like adults, as you and Jeff were talking about? And there was a posit that is it around 10 perhaps, though there may be some scant evidence on that respect. But and I think the practical impact of that, would it be you know, PPE requirements like masks, or what would differentiate a kid who's young enough to not be at higher risk versus, you know, old enough? What are the practical implications of that for planning and policy might be a valid question to come for our discussion. And then secondly, there was a case in Amy Clark in New Hampshire was concerned about schools that simply don't have, if I captured your question right, Amy, don't have HVAC units that circulate the air. It's more open air environments. So what are some of those considerations that might be brought in? And I'll mute.
Yeah, David, I think we'll touch on that. And if we don't, as we move through the information, and if we don't, please bring us back to it. And I think Jeff could also advise, but it is as the evidence that we saw in the research was, yes, as students become older, it is that they contract and transmit like adults. I don't recollect the age break at that, but I do recollect that we reviewed the evidence and the research at that point. In terms of HVAC, I think hopefully we'll get to that. We will get to that as we go through these. What I thought would be helpful is there were 9 recommendations. We just talked about the first one, and that being, to weigh the relative risks. I think every single district out there is doing that as we speak. And I think that partially, we're speaking to the choir in terms of people knowing what the value of in-person instruction is. And some of the constraints with virtual learning that I know is different than when we closed, because we've had the summer to really address that, but it still is not the same. And so particularly for young children and for at-risk, for our special needs students. There were 9 recommendations, and they're on the screen. I know too, David, that you sent out a summary of those recommendations before this meeting. I don't think, we need to really go pedantically through each one of those, but there are a few that I would like to highlight, and then perhaps too, Jeff has some that he would, want to speak to as well. So why don't we go ahead to the next slide. I thought in terms of also thinking about, well, how is this guidance, how is this document different than the gazillion that everyone is reviewing out there is already? And I think as I've read through the documents and been honored to be part of this committee, is one thing that that we really said was the precautions for opening schools, that surgical masks be provided for teachers. I think that differs a little from some of the guidance that I've seen. We've seen a lot of masks for all, but surgical masks for teachers. And the reasoning for that from our epidemiologists was that a surgical mask also provides protection for the wearer. And as we know, the teachers and adult personnel at school is more at risk, and that's why this recommendation is here. And I just think it's one that is a little bit different than things I've seen in other publications, but came very strongly through our consensus process. Go ahead to the next one, David. I think really the central focus in this publication is this decision-making metrics. And that we really were saying that the decision-making needs to be inclusive and data-driven. And I know, again, probably everyone on this telephone call knows that. However, there were, I think, nuggets of information about risk decision-making that is very helpful, and perhaps if that is of interest to you, those are where you could focus some of your energies. And one in particular, go ahead to the next slide. We heard from in terms of a data-driven framework. We heard from a doctor and professor at the University of Texas in Austin, and this is their framework of what, and really on the left-hand side, this recommended threshold that they were utilizing in Austin is 7-day average hospital admits. So you can see that is the data point on which they then hang the stages and then the mitigation strategies. Also, the state of Oregon is an example provided in the document, and they have a 7 thronged, I guess what you'd call them, thresholds.
Decision tree or something.
We also call them kind of gates. You know, you see them in different states. It's, you know, how many hospitalizations, how many, you know, one of the components of is how much absenteeism in a school, these kinds of things. But those are frameworks where perhaps there aren't frameworks for school districts to be able to use as examples. And again, they're not they're a framework that you put together with your health professionals. As we know in education, we're educators, and you know, we work within health environments and health issues. But this is really one in which infectious disease and utilizing county and state health professionals is really important and key, and actually a recommendation of this report. The next slide. I thought too we would touch on this recommendation for high priority mitigation strategies. And again, it is not anything that you have not already seen, but this report, you know, with the evidence, has really said, you know, prioritize mask wearing, providing healthy hand hygiene, physical distancing, and limiting large gatherings. And I think what it also says is cleaning, ventilation, air filtration are also important. And I know that was one David from one of our participants is talking about, you know, what do we do when our school is not well served and does not have good ventilation systems. And really what was said in this report is that those are important, but as a strategy alone, it will not be sufficient for lowering the risk of transmission. The other promising practice is creating small cohorts. We hear a lot about that, and limiting the amount of time that one teacher has with different groups of students. So that was also a promising practice. Next slide. I think, Jeff, were you going to talk here on the hierarchy, or did you want me to?
Yeah, I can mention it and feel free to chime in, but, you know, in terms of trying to understand the mitigation measures, kind of like what I, you know, was getting at before, what we had hoped to do was to really, you know, provide additional, you know, guidance and understanding on kind of the relative effectiveness of different mitigation measures. You know, I think that we did not we certainly do that to some extent, at least that the evidence is known. I think there's a lot more to be learned about that. And that's part of the recommendations, is really to study school reopenings and to study the different mitigation measures that get put in and how does that relate to transmission. And that's actually one of the things, you know, we're seeing, you know, folks have been trying to understand what other countries have done to reopen. But what we don't have good information on that is really a clear and very detailed understanding of what mitigations they did and did not do. But also then we're not seeing data yet on what the transmission has been as a result of that. And I saw some folks have posted some news stories, and, you know, we're certainly getting some of those, but in terms of really a scientific understanding of that, you know, remains to be seen. But what we were kind of framing our understanding of mitigation measures was the hierarchy of controls, which I'm sure many of you are familiar with. You know, this one in particular is used by NIOSH. I think is where the image comes from, but essentially, you know, we're not eliminating the virus without a vaccine. Substituting the virus is, well, essentially physically closing schools and being, you know, schooling at home is essentially substitution. But really where schools are at are in the bottom three: engineering controls, administrative controls, and PPE. And I think, you know, ventilation and, you know, cleaning and ventilating the air inside spaces falls under air engineering controls. And one of the things that the report does, which I was very happy that we were able to do, is to really emphasize the importance of indoor air quality and ventilation in transmission reduction strategies. Because even when you look at most of the state guidance, it gets very quick mention in most of them, you know, compared to some of the other measures of spacing, of cleaning, certainly. And so really at the very tail end of this committee's work was when the explosion in the understanding of aerosol transmission was happening. And I'm sure you all have seen the letter that, you know, a few hundred scientists wrote to the WHO about aerosol, the tiny droplets that float around that don't fall onto a surface, you know, within 6 feet or so. But that those accumulate in indoor spaces that do not have fresh air circulation, I think. And so us raising the issues in the report around the inequities inherent in that, because I think Amy Clark mentioned it and others, there are lots of schools that don't have HVAC systems. They don't even have them, or they don't work. And again, that gets to the recommendations around emergency, you know, that we point to around emergency funding from states and federal governments to fix those things very quickly to enable safe reopening. But you can see then, looking at the hierarchy of controls, you start to, it's a good framework for trying to understand the relative effectiveness of these things. And again, as everyone's pointed out in the chat, the science on this is rapidly evolving, you know, particularly the science on transmission among children. I think we have, personally, I think we have a lot to learn about that. You know, the early news was good news. I'm not so sure it's going to totally hold, but we'll see. But, you know, the report is very clear in recommending masks, as Kathleen said. And I believe, Kathleen, correct me if I'm wrong, but it does recommend masks for all adults and children above 2nd grade. And that, I thought, was a pretty firm line that it drew.
Yes, and I mean, its recommendation was for all students, and with the acknowledgement that younger students it may be more difficult for, but that here are some ways to be able to help and encourage that. So it was all students, and with the knowledge that, you know, it's going to be more difficult at the lower grade levels, and as I said earlier, that it's surgical masks for teachers. So it is 100% masks. The 3 real big mitigation strategies emphasized are masks, physical distancing, and hand washing, and as Jeff said, you know, also air quality is very important, and other cleaning and those components, that we also know these are all have to be weighed within each individual local circumstance as to what they can do personnel wise, what they can do you know, with their funding. And I think a really strong point of this report may not be at the implementation level for many of our participants here today, but is really a document that is being utilized to secure state and federal funding, which we say it's just not possible to do these strategies and to open safely without that type of funding dedication. So, and then I think too, and Jeff touched on this in the framing component of it, is we're also in the backdrop of a very historical moment, and that, you know, racial inequity in our schools has been exacerbated by COVID-19. And I know, you know, Jeff's spends a tremendous amount of his time on research in terms of conditions of schools and low wealth communities and what that means. And really what it means is that these types of communities have even added needs and expenses to ensure a safe opening. And that I think is an important component of this research and this report as well.
Kathleen and Jeff.
Yeah, and maybe
if I
yeah, I mean, we're pretty much done. I mean, you could go to the next slide, but I would love to sort of entertain more questions. And I think we're kind of wrapping up.
Yeah, I would love to just bring up, some of the great conversation in the chat right now. One of the questions on N95 versus surgical masks, and all we heard was N95 for quite some time. Why surgical over N95? If that can be spoken to. There was a comment about, well, in Minnesota, schools are being asked not to wear surgical masks to reserve those for hospitals. But I, understand that what you all are looking at is sort of efficacy on the face of it rather than supply questions. If you could speak a little bit to the different kinds of masks there, and then some questions specifically about UV filters, ionizations. We don't have definitive data right now, of course, on those systems as they mitigate the threat from this particular virus. But I should imagine that we have better data on how other such filtration systems in our MEP and HVAC can help filter out other viruses that have been around for some time. Do you have the ability to speak to those points?
I'll speak to the mask.
Well, I know the report. Yeah, okay, go ahead. I was going to, but you probably know it more than I.
And you can add and speak to the ventilation point. Again, on the mask, it was with our epidemiologists and our health experts that were on the committee. This was in consideration for adults and teachers in this environment, and they said, the surgical mask is one that protects the wearer. And as we have said, the adults are more at risk. And so that is where that recommendation comes from. I too understand, the chat of these may be in low supply, but that was not the consideration. It was what is the best recommendation for coming from this group of experts that they have for this. So that's where that piece came from. And maybe Jeff, you want to handle the ventilation one?
Yeah, I forget the exact. Was the ventilation around UV? I forget what the question was. I mean, the report certainly makes a very strong case for ventilation strategies. In terms of linking it to what we know now about the airborne nature of it, and calling out very specifically that lots of classrooms are not equipped with ample, ventilation, HVAC, air cleaning systems ability to mitigate what we know about, a dozen humans in a room together, one of which may, have the virus and thus it would spread. I mean, it makes a very clear case about that, tying it to existing conditions in schools. I don't think, I'd have to do a word search. I actually don't think we address specifically UV in the report, but someone else who's read it may, I don't think we do. I know that some people put some stuff in the chat. I think that knowledge is still evolving. Someone mentioned how expensive it was. The folks I've been following on those issues in particular have been the group, the Healthy Building Group, or at Harvard, at the Harvard School of Public Health. Joseph Allen and his colleagues have been doing great work. Many others, but also the Indoor Air Center at University of California, Davis has been doing a lot of work on this and put out a report on mitigation measures as well. Folks probably have other things to point to, and other, lots of people are looking at this. but again, I think it's I think Guy hit the nail on the head here. We have a timeline issue and a money issue. That's exactly right.
Yeah. These things take time to identify, procure, install, and we are running out of it.
I mean, related to that, one of the things that I'm getting hearing a lot more talk about outdoor, holding more classes outdoors, because the virus specialists and these kind of new Twitter rock stars that are people that study aerosols and viruses, who probably never thought they'd be famous and probably never wanted to be, because they never wanted their work to be that necessary, probably.
Right.
What they have been saying is that the risk goes way down if you aren't, in outdoor air, even if you're in a group of 10 or 12 people kind of working together. And there was a great New York Times story last week or so about the 1918 flu pandemic, about showing all these outdoor classrooms on rooftops and everything in New York City. And I know there's been some questions in California, and I know I have my California, Sacramento colleagues on the phone about, what kinds of tent or carport rather structures would be allowed to put in parking lots or on fields, et cetera, to hold outdoor classrooms in shade or keep rain off, et cetera. So that seems to me like a really big area of interest. I would love to hear folks' comments on it.
And I don't know, is Sharon Danks on the call? If she is, type it if you are, Sharon, the message in the chat. But if you're not familiar with her work, she's been on the webinars quite frequently. She's with greenschoolyards.org, a nonprofit that provides guidance on outdoor learning spaces. We have no relation to her at all, but we've had several conversations. She knows her stuff in this field, so look her up if that's something that you would like to explore, as she's a real expert in that particular field. There's a comment that came up from Dr. De Silva in Rhode Island about what about looking at in classroom units. Is there any known research or things we can point to about having standalone, like plug-in purification systems, HEPA filters, like things you can buy at your local Target or Walmart or something like that, to go aftermarket in the classroom? Is there any thoughts on those in addition to, or in some cases perhaps in lieu of, centralized solutions?
I don't believe the report addresses that.
Yeah, it does, and I think it mentions them because they're mentioned, but it doesn't go into the science, and that was one of the things I think that we didn't pick up enough. I mean, my sense is the understanding of that is evolving. Amy put the ASHRAE links in here. I mean, I forgot to mention ASHRAE, of course, in there, but it's I don't know. We are not air filtration specialists, and it was actually, personally one of the. I wish there would have been someone with that directly on the committee, and as opposed to just having a couple speakers in that area, particularly given what we know about viral load spread.
There's a lot of great links that folks are putting in the chat, and so if you look at your chat and you look at those three little dots next to it, you can a little pop up, it'll say save chat. Highly recommend doing that. We'll download this and we'll post it to our website with publications, but and send it on email, but highly recommend that. And folks, we are 10 minutes to the top of the hour, but if Jeff, Kathleen, if you have a couple minutes afterwards, if we go a little bit long, and you're amenable to that, we can go a few minutes long if questions and comments and necessitate here. Did you want to go into the next slide here, Kathleen?
I think Jeff was going to take that one.
Or Jeff, okay.
I mean,
go ahead, Jeff.
We've kind of talked about this, but again, to Kathleen's point about the impact of the report, not certainly giving some help to local folks that are trying to, reopen schools and implement things, but also really to state and federal policymakers, making it clear about, there's cost to mitigations, there's, and that there's a role for the federal government and state governments. But I think that, one of the things that, the report very clearly lays out is that there's a huge urgency for research. I mean, people keep bringing it up. I mean, even this relationship between the role of face coverings and different masks and virus, and disentangling that from, oh, we don't have enough, so don't wear them because we're reserving them for medical professionals, is a different thing than which mask actually works best to protect the wearer and others. But we lay out, desperately, urgently needed research. And this is what's plaguing, reopening decisions really is not enough info on this. Children, and really the four big areas were children and the transmission of COVID-19, as we've already talked about. The role of reopening schools in contributing to spread. I mean, there's been some big data studies that came out, a month or so ago that were saying, oh, reopening schools didn't have any effect on the levels of spread. I think people are trying to really dissect that. Part of it is a data collection problem, right? Internationally, et cetera. And I think, when schools start in a month or so, and some of them physically reopen, we made an urgent call for people to be studying what mitigations are in place. What does the community spread look like at that time? How is it changing when schools do reopen, and try to understand those relationships, right? But as we're seeing, as each day rolls by, there's going to be less and less physically on site-based reopening, particularly in a lot of states. The third one here, the role of airborne transmission. We called that out specifically in the research because that really, is really just kind of blew up, I guess, or really came to the fore, much later than some of this other understanding, and even that letter to the WHO that I referenced. I mean, those scientists are saying that actually surface transmission, that is, if you coughed on the table and then someone wiped it and licked their hand, is actually, they think it might be happening less than just airborne transmission. And in some ways that flips on its head some of the guidance. So should you be putting all your marbles in cleaning versus putting very few marbles in kind of HVAC air quality stuff? At the very least, you should probably be balancing those out, I think. But I'll stick to what the report says for this presentation. And then the last one, the effectiveness of different mitigation strategies, which relates to what I was saying. But there's not enough known about the combination of strategies, right? So right now, everyone's trying to kind of do them all the time, which is the smartest thing to do. But of course, there are feasibility limitations to those things. But getting a better understanding of the effectiveness of different things. So yeah, there's the link, and the folks who really led it, who really would be the ones I think to contact. And Kathleen and I can funnel you to them, but in terms of dissecting some of these questions.
And I would just add,
I don't know if you want to ask Mary Filardo to comment as an advisor. I'm sorry to jump in, Kathleen, but I noticed she's on, and she was an advisor to the report as well.
I think that would be fantastic. Mary, you've had quite a view of this whole conversation, and for many months now. As you've been listening to today, what's popping in your mind about sort of actionable questions, actionable things that the districts need to consider for the next few weeks?
I think I'm muted.
No, I can hear you.
Oh, you can hear me? Oh, fantastic.
I can.
Hi, everybody. I mean, I think it was clear that the committee worked really hard and tried to wrestle down a bear to build that bridge between kind of what's known in the health and science and what schools are faced with, both in terms of thinking about how kids are doing, how teachers are doing and other staff, how meals are getting distributed, all of those huge responsibilities that our schools take on in our communities. I think that it's a little bit in the mix in terms of you know, there wasn't as much clarity, I think, as people thought we would end up with after the time and really, you know, careful work on the report. What I think is going to be important is that the bridge between our health professionals and our school professionals, I think that we have to do more on that. And one of the things I did ask Heidi the other day when I was talking to her, if she would even come and talk with this group as well as, you know, Jeff and Kathleen have, but bringing some of the health folks in to the conversation sort of more directly with a larger group of school folks. And she said that they would absolutely do that. So could put that on the list. The only other thing before we leave, I put it in the chat, but part of why I stepped away from these really great conversations is trying to actually get dollars for the poorest school districts for the reopening. And this is a major concern. It was brought up in the report. Jeff spoke to it, and Kathleen, that acknowledged that the schools in poor condition are putting kids and teachers at higher risk. And so right now we have a proposal that we're pushing as a part of the reopening, which is $10 billion to go in for emergency repairs and system upgrades. And we're hoping that goes in addition to education dollars, but we know that leadership is looking at it and trying to figure it out. But it would be great, frankly, if folks just pinged their officials to say, you know, we're really struggling we want to reopen, but we only are going to reopen if we think it's safe. And a part of what's in that critical path is our building conditions, because even it isn't like, oh, we're just going to reopen, you know, our regular day in August or after Labor Day, whatever your districts do. You know, again, it might be pushed a little bit, but we are all trying to reopen. And so I think that making sure that the critical path and what's on that is clear for our policymakers is going to be really important. So that's what we're trying to do. And just so you realize, it's not in the Republican proposal. It wasn't even in the Democratic proposal. So this is, once again, the school facility piece, you know, is not thought of in terms of relief or aid. And so we need folks to speak up on that.
Yeah, thanks, Mary. And this, you know, for those of us on this call, you know, we're on this call in part, we know school facilities. We all know the buildings that are in decrepit condition, where, you know, really they need a bulldozer, and new facilities where, you know, HVAC systems, MEP systems, just basic interior systems have really rotted beyond their useful life. And unfortunately, it seems like that's the best kept secret in a lot of the national conversation. And Jeff, I know that's a lot of your focus and work as well. And it must be many banging your head against the wall moments at this time. But to echo Mary's point, it's let's all advocate our school conditions. That is a very powerful point. You know, maybe we can conclude on this, Jeff and Kathleen, the inequities that this highlights from a physical plant perspective as well as the educational perspective. Maybe could you conclude on that with both of your, you know, personal thoughts on where do we go from here to really address that problem?
I think part of, I said it during my discussion on the slides, is that, you know, given those historical inequalities and also the known issues for low wealth areas for conditions of schools, is that, as Mary is pointing out, you know, additional funding is needed to bring those schools up to the capacity to then also be able to do the mitigation strategies that are being asked of them in this situation. And I think it just highlights that issue and calls for all of us to solve it, because we just, coincidentally at the same time the GAO report came out, we had members of our committee say, I had no idea about the conditions of schools. And these are, well-informed other members that we haven't yet made that universal case that, the conditions of many schools across this nation really need attention. And we cannot do it alone, and we need this, we need the funding help to do so. And I just think that this points that out even more so.
Yeah, I think that's right. It's always been an uphill battle to make the case for school facilities quality, particularly in lower wealth communities, as you all know. And so, I mean, but I think we have to keep hammering what Mary said, which was facilities, good condition facilities, however you want to say that, is in the critical path of physically reopening in this COVID pandemic, period. That also still is a big case to make, but perhaps if there's a silver lining in all this is that we do that and there's more of a public understanding of we get cleaner schools, we get better air quality in more schools, and some of these other things coming out of it, if we can shine a light on this. So I think that it's definitely going to take all of us to convince those that particularly pull the purse strings that this are areas to invest in, both right now for emergency reasons, but also for longer term structural changes for better resiliency, right, against crises like these.
Yeah. Excellent point. Well, Jeff, Kathleen, Mary, thank you very much, of course, for your work on this report and contributing it to it from the facilities and educators' perspective. And that's for being here today to share your insights on it and answer the questions. Folks, for the links that you put in the chat, great resources. We will send those out to you all who are on the email list. But if you'd like it to snap right now, go ahead and save that. There's a wealth of information in there. Talk to each other. We look forward to continuing the conversation here next week and as we go on. And one of the things that it just seems apparent, and I think, Jeff, you brought it up in the beginning, is we're going to learn a lot as we open. So we want to continue this forum as we move through the fall and really pivot the conversation to what should we do to how's it going, and how can we adapt and improve our responses to this thing, and we'll do it together. So everybody, have a great rest of your day. Thank you for your time, and we'll see you soon. Jeff, Kathleen, thank you.
Thank you.